Everybody. Welcome to this very special interview. I am privileged to have one of my mentor, close friend, and a very experienced surgical gastroenterologist with me. I would like to first of all introduce the personality with me, and I'm going to take his time and share his experience with all of you so that you benefit from him. So I'm very honored to host Dr. Samrat Ray, who is a surgical gastroenterologist with an impressive array of accomplishments. He is an alumnus of University of Delhi, distinguished himself early on with securing gold medal in the Delhi Medical Association for highest marks in his MBBS days. So like he's the very ranker sort of personality from the day one. And along with this, he also has secured multiple gold medals in his journey of the medical education. And not just the clinical excellence, also I would like to share that he has distinguished in the field of surgical gastroenterology and also transplantation. He currently serves as a postdoctoral research fellow in the pancreas transplantation at the Toronto Organ Preservation Laboratory. His future appointment also include the prestigious role of ASTS and HPBA clinical fellow in abdominal organ transplantation and HPB surgery at the Toronto General Hospital, University of Toronto in Canada. He is also a prolific contributor to the medical science. He has authored more than 44 publications. He has delivered 18 oral presentations and is also a recipient of significant awards and grants, which also include the TTS Mentor Mentee Award in 2022 and the TTS Scientific Congress Award in 2023 and the Ajmera Transplant Center Fellowship Award grant in 2022. His research work is so extraordinary that it has been recognized in Toronto as among the top 8 from the University of Toronto in the Ajmera Transplant Center podcast. Now, Dr. Samrat Ray, his journey is a testament of his dedication, his excellence, his sincerity to the field. And I'm very much proud to have him giving me this interview. And also, I'm eager to share the experiences with you all. And I would also like to add a personal touch that is also one of the person who has been a major guiding light for me in the field of surgical gastroenterology to the phase where I have reached right now. So welcome, Dr. Samrat, and thank you for taking out time to give me this interview.
Pleasure is all mine, Ruchir, and thanks a lot for this introduction. That was very kind of you.
So I want to share your experience with many people, which include the aspirants who are going to pursue surgical gastroenterology. Some of the people who will be watching this would be who are pursuing surgical gastroenterology, who have passed surgical gastroenterology, and who are also preparing and are also in the dilemma to what to do and what not to do. So I like to ask or start off with a very simple question that please let us know about your journey from the MBBS days, that is a completed or MBBS in India, and to the current position where you are in Canada.
Okay. So it's been a long journey. Like I entered MBBS in 2005 and I did my MBBS from UCMS and the University of Delhi. And I always knew that I wanted to pursue medicine. There was no other career choice for me and that was completely by will because my parents really wanted me to pursue something else, which is not medicine or engineering, because I was very good with literature. So my mother really insisted that I should pursue a career in journalism or mass communication, something different from what it is, what the usual route is. But then I identified myself as only a doctor. So, and very early on during my MBBS, I also knew that I want to take up something surgical. The confusion was between obstetrics and gynecology, orthopedics and surgery. I really liked gynae. To my surprise, or even to the surprise of many of the listeners here. But then it was very fruitful all throughout my MBBS days. I used to always follow a very methodical approach in studying. It was not like I used to study all day long, but I was very consistent. There was hardly any day where I didn't study, even if for like an hour or two I used to study. And the night before the exams, I used to relax. That used to be my funda during all my MBBS exams. That the night before the exam, I need like 7 to 8 hours of sleep, And so it used to be a very consistent way. And I think that really helped me a lot in being consistent with my subjects during MBBS, which translated into good result in all my professional examinations. And subsequently, I appeared for the PG entrance examination, where by choice I had taken up MS General Surgery from Maulana Azad Medical College. So those 3 years were also very fruitful for me because I learned a lot during my general surgery residency in Maulana Azad. And at that time, I had decided that I developed a great interest in GI surgery because I was very intrigued by all the pancreatic resections and things that I used to read about, and some of which I used to even see being done by some of the consultants in Maulana Azad in general surgery. So that helped me develop that interest. And I started studying for the MCH exam alongside my PG exit exam. And thereafter, within 6 months of getting done with my general surgery exit exam, I actually got admission in Gangaram Hospital. I cracked the All India DNB exam, and I also got a rank in AIMS SS exam. These are the two main exams which I had given. But AIMS I missed by one rank because I was rank 4. I was waiting list 1 after the interview. And in All India, in the DNB seat, the SS exam, I secured I secured an All India rank 3. And I decided that I want to take up Gangaram Hospital, which was, I think, the best decision I've ever made in my life, like so far. So those 3 years in Gangaram, where I would say the turning point where I really knew what I wanted to do in future, because GI surgery is a very big, it's an umbrella branch. It's an extension of general surgery. So there are many subspecialties within GI surgery, and as GI surgeons, we need to decide what we want to do subsequently. So I knew that from the end of, like, towards the end of my first year of DNB in GI surgery, I knew that I want to pursue a career in transplant, because I still remember one of the OTs where one of the consultants told me, like, I was just a first year and I was assisting him, and they just told me that the beauty of organ transplant is the miracle that you see in front of your eyes. You don't have to wait. You see the results right in front of you. The moment the graft perfuses and the organ perfuses, you just see it happening. So I always found it very fascinating and very challenging. And also, I was fortunate enough to be trained by some of the best transplant surgeons. One of them happened to be my mentors as well, Dr. Mehta. And of course, needless to say, Dr. Nandi, who was like the pioneer of GI and liver transplantation, was my guiding force. He still is. So, because of the guidance by these people, I decided I wanted to pursue a career in transplantation. Now, the question was whether to do it in India or versus in North America or elsewhere. North America was never on my plan, to be very honest with you. I was more fascinated towards the UK. But then, like when I started preparing for the exams and things like that, like MRCS, I was guided by some of the other consultants who were around. And they said that if you have time and you can study, just prepare for USMLE. It might be more arduous to prepare for USMLE, but at the end of the day, it will be more rewarding because the North American fellowships are absolutely unparalleled. There is like no comparison of the North American fellowships with any other fellowships in terms of training, in terms of surgical training. And that's how I decided. So I gave my USMLE steps during my second year of DNB GI surgery. And after getting done with them, I finally decided to actually apply. But then COVID hit, and I was unfortunate enough not to be recruited. During that time, I served as a consultant in Gangaram Hospital, learned a lot again during those period, and that's the time when I met wonderful people like you as well, where I got to train really good and motivated residents like yourself. And subsequently, I got this opportunity to pursue my career ahead as a research fellow in Toronto. Uh, and because my interest in research also developed during my training as a DNB resident, because of Dr. Nandi again, like who's a teacher par excellence. So subsequently, I joined this lab as a research fellow, and I gained a lot of expertise in animal research models and basic translational sciences. And subsequent to that, the journey has been like amazing in the last 2 years. I've published a lot of papers, have learned a lot, staying in basic sciences, which we don't usually learn as a surgeon who's only doing clinical responsibilities in our usual clinical practice. So it's been very rewarding. And in the last 2 years, I have also realized that in future, I just don't want to become a transplant surgeon. I also want to become a transplant scientist, a surgeon scientist, who's basically going to be devoting 75% of his time into the clinics and 25% into core research. So this is how the journey has been so far. And from 2024, I have been lucky enough to be recruited by the same team in Toronto General Hospital, which was very competitive, to get the ASTS fellowship. And I will be starting the clinical fellowship in abdominal organ transplantation from 2026 August, 2024, sorry, 2024 August, and going till 2026 August. So this has been like the summary of my journey so far.
So your journey actually is a inspiration for me on a personal note, because I've worked, like I have learned from you, I've worked with you, under you, and even learning from the mentors, what you said, like Dr. Samiran Nandi, Dr. Namish Mehta, whom you have learned from, and along with them, and you were the mentors for me. Like it has been a journey which changed my path towards the field of surgical gastroenterology and transplantation, like you also went through. So I'm really very thankful. And what you said about your journey, I feel that it should be really an inspiration for all the listeners out here who are wanting to pursue a career in surgical gastroenterology. So coming on to that aspect, in your career as a GI surgeon and a transplant surgeon till now I'll ask you two things. What has been the most rewarding aspect of this profession? And also, as we all know that it is always a negative aspect is there. So what are some challenges which you faced, or what are the pros versus cons, if I simplify it?
Okay. So to answer the first part of your question, which is very simple, I would say, I mean, every day being a GI surgeon has been rewarding for me, because there's not even a single day where I actually felt like, oh, I should have taken up something else, or I should have pursued something else. Because as I told you, GI surgery is very rewarding, but at the same time, it's very challenging, because most of the surgeries that we do, if like my interest lies in HPB and transplant, HPB surgeries are very complicated. So after doing a Whipple, you have sleepless nights for the next 2 days. Not anything can happen. So that challenge is there. But like I said, I always identified myself in that field, in surgical gastroenterology or in HPB surgery, to be more specific. So the very fact that I have been working on what I really always wanted to do from very early on in my career has been the most rewarding part. And to see myself actually continuing my journey so far and not being deterred by any of the challenges that I faced is also the most rewarding part, which keeps me motivated every day. Then coming to the second question that you asked, the pros and the cons. Definitely, there are many pros and cons. It all depends on your approach, to be very honest. And it's a very subjective answer that I'm going to give. For many people, like the priorities after becoming a super specialist or like a GI or a cardiac surgeon, whatever, is probably defined by the monetary outcomes that you get, like how well established you are in terms of whether you are earning XYZ amount of money, or, like the financial return is a big indicator of their success, even in their heads. That's never been the case for me. So, since it was never the case for me, that's why I preferred to actually leave my comfort zone from Gangaram Hospital, where I had a permanent job as a consultant, that job that kind of everybody dreams of as a GI surgeon, because Gangaram Hospital is one of the best places in India to actually work, one of the most secure places. So, the very fact that I did not really think much before leaving that comfort zone and venturing into something like a research fellowship, which is absolutely like an area where nobody is there to give me any kind of guidance. So it's basically venturing into nothingness without any kind of support. Was I don't really regret that decision at all, because the thing is that I always knew that I wanted to challenge myself more and more. So with this kind of an attitude, I always feel that GI surgery is a very rewarding branch, because you get challenged every, like with your every step that you do in your career. When you go into practice, like an independent practice, you have to compete with the general surgeons, because, as I said, GI surgery is an extension of general surgery. Especially like after finishing my DNB, I went to Mathura, like, for 1 year, 3 months. Small place, not a single GI surgeon over there in 200 kilometers of radius. but I had to fiercely compete with all the general surgeons, and then the competition was really unhealthy. Like, unfortunately, people did not really support me because, of course, you like needless to say, like most of the general surgeons are not happy if a guy who looks half their age comes and claims to do more complicated surgeries which they are not able to do. So I used to face things like where they are driving the patients away somewhere else and trying to demotivate patients to get operated by me. But I think those are all a part of your learning, because I would say even that experience taught me a lot. It taught me how to navigate through these challenges as a practitioner in India. Because if you're in India and you want to practice, whether it's any branch, you're going to face similar kind of a challenges. Like, there is no perfect place like that. And the more you learn all of these things, which is also part of your learning experience, which nobody teaches us during our MBBS days, the more mature you become as a surgeon. So these really helped me at the end of the day, like, navigating through these problems as well. That's why when I joined Gangaram as a consultant after Mathura, my approach was way more mature, and I did not face as much difficulty as would be anticipated by, somebody who's so young and who has joined as a consultant in such a big hospital like Gangaram. I did not, because I honestly knew the ways to some extent to navigate through those difficulties in a nice way, without creating any kind of problem in the practice. So these are certain things which are very important, but unfortunately, nobody teaches us during our MBBS or MS days, or even during our MCH or DNB days. But these you'll only learn when you actually jump into the practice world, which is entirely different from reading Bloomgart and Shackelford. So yeah, so these are certain challenges that you face. Besides that, of course, it depends on your personality. Like, I am a very risk-taking personality. I like adventure, so that translates into my work as well. That's why I dared to actually do cases like Whipple's and hepatectomy in Mathura, where I knew that if there is something wrong that happens, I don't really have much of a support system in terms of anesthesiologist or any senior surgeon who can really salvage me out of the situation. So I used to consult my mentors back in Gangaram. They used to guide me. And then like I kind of had confidence in my training in Gangaram. And that's how I started doing cases slowly and slowly. And I kept on improving with every case that I was doing. And that's how I kind of learned.
So,
So yeah, these have been like the challenges and the rewards that I faced so far.
right. So one of the key points what I feel is that if you want to pursue surgical gastroenterology or the GI surgery as a profession, you need to be passionate about the subject. I think that is what I would take from you, what you said.
Yeah, yeah,
And secondly, you are going to face challenges no matter you take surgical gastroenterology or something else. It is all about your passion and hard work at the end of the day.
yeah, yeah,
So on that aspect, just one more thing, what I would like to ask you is that for the surgical gastroenterology residents who would be watching this, if you can share something as a small take up a message regarding how should they go about the residency, other than the aspects what we are already doing, like seeing the patients, OT, theory,
yeah.
reading, everything else. Just something other than that, if you want to advise the residents right now, what would
Yeah.
you tell them?
Yeah, the most important piece of advice would be, which I've given to you as well, if I remember, when you had joined your residency, surgical gastroenterology, is there is no perfect place of pursuing a residency in India. Yeah, let's talk about India right now. So in India, there is no perfect place. Like, the people who are doing the residency from Nizam might be saying Asian is better. From Asian might be saying Gangaram is better. From Gangaram might be saying Asian is better. It's a never-ending battle. So, in my opinion, be happy with where you are and learn the best from whatever you have around you. That should be the first thing, instead of complaining from day one, because this is what you have for the next 3 years and you have to make the best out of it. So there are many centers which don't do transplant, but they do good amount of minimally invasive surgeries. So like they do a lot of bariatric hernias and things like that. Then there are some centers which do transplants, but they don't do much of colorectal. So every center has its strengths and limitations. So instead of thinking that okay, my colleague from the other center is getting more surgery or seeing more, just try to learn from what you have around you.
Definitely.
Secondly, based on my understanding, hands-on is a very important thing in surgical training. But unfortunately, our surgical training, whether it's in general surgery level or it is in the super specialty level, at least in surgical gastroenterology, it is not standardized in terms of hands-on exposure. at some institutes, they like there are mentors who really are motivated enough to train you in terms of giving you hands-on exposure. And in some, like there's huge volume, but then they don't really believe in giving you hands-on. So I'm not justifying not giving hands-on, but at the same time, like we need to make the best of what we have, like I said. So even if you don't get hands-on, there is no point of complaining and bickering about it. Try to assist as much as you can, because this is what even I have gone through. I did not really get much of hands-on exposure while my general surgery residency in Maulana Azad, or even during my DNB surgical gastroenterology training. But still, at the end of my surgical gastroenterology training, I had the confidence to start something on my own. And in a place like Mathura, where I could do 170 patients in 1 year, all by myself, from minor surgeries to major surgeries like Whipple. So I think if I could do it, then so could all of you guys. So I think it's all about how much you see, how much you learn, how much you assist, which will definitely help you evolve. Definitely, in an ideal world, you should get hands-on. But as I said, we are not in an ideal world, so
Exactly.
we cannot just keep complaining about it.
Exactly. So
Yeah.
even that is what, like, some of the people who approach me, even I believe in that it's more about quality, because we cannot change the hands-on aspect. So we just need to see whatever we can and learn from it.
Yeah.
And moving on to something which really made that spark in me regarding the paper writing or research. Now, how you are a prolific writer, like in the paper aspect in the medical field, like we have already introduced and told about your accomplishments. So how do you perceive that role of research and academic contributions, like paper writing in the medical field, especially, not just like, basically I would like to ask you regarding India, because we are all aware that outside India, in North America, Canada, everywhere, they believe in research, but it's
Yeah.
not the case in India. So
Yeah.
how important is it for the upcoming medical professions, or in a general aspect in India?
Well, it is very important. In one line, I can say it's extremely important, and every surgeon should definitely continue, like have some idea of how to do a research, of how to do a surgical research. But having said that, it's not in our hands, and it is very much guided by how your mentors are. Like based on my own personal experience, the knack of doing research in me actually came because of my training under Dr. Nandi, who himself is a prolific researcher and is a very good teacher, in a way that he motivates you to do
Yes.
research, and he rewards you by making you the first author in papers, or
Yes.
giving you that like valuing your contribution. So in most of the places, many of the students, they get demotivated to do research because of many of the hurdles. So one of the biggest hurdles is lack of good mentorship, where mentors themselves don't know how to really do research. So they demotivate just by saying that, okay, those who do research, they cannot operate, and those who cannot and those who are like spending more time just doing research, they are basically bad surgeons.
Yes.
So that kind of dictum they kind of transmit in different generations. So as a result of which, people are demotivated because young surgeons have no idea. Because unlike North America, as you rightly said, we are not really taught about the importance of research from the beginning of our career, from our medical school days. So as a result of which, we don't really know whether research is good or bad for our career, for the starters. So that is one of the biggest hurdles. Besides that, the next important hurdle is, many a times what happens is, research malpractice happens, where the mentor is making the supervisor is making their trainees do all the hard work, and in the end, they are not even giving their dues. Like they won't be made the first author. They won't be made. They'll be probably made third or fourth author. So as a result of which, people get demotivated, deterred. But versus if you have a mentor like Dr. Nandi, who would make sure that if you do research, it gets published and you are the first author, and even if it is in the best of the journal, you get the highlight. I mean, you get highlighted for what you have done. So that really motivates you more and more. And this is what even helped me. Like when I saw first two, three of my research work published in a journal and with my name as the first author, and people coming up to me and telling that, oh, we read your paper, that really motivated me a lot, because that's a kind of a happiness that you'll not get otherwise. So that is the first important thing, which definitely would be an important aspect for everybody who wants to be a researcher, or who wants to pursue research in surgery, in surgical training, is basically to motivate each other. And if when you assume a role of mentor, at least be a motivator to your mentee. And as a mentee, you try to reach out to your mentors who are motivated enough to actually give you that opportunity to do the research. And besides that, what I have realized so far, reading books is not really enough to actually enhance your knowledge about different things.
Yes.
Because books, they keep updating books like Bloomgart and Shackelford every 5 to 6 years.
Yes.
But medical research or medical technology changes every 6 months. So if you are not updated with what is happening in the, in the real world scenario, by reading different journals or by reading the different papers which are coming out in every monthly issues, you will be outdated. Absolutely. If you just rely on what is written in Bloomgart and Shackelford and not reading any papers, you definitely are outdated. You might crack an entrance exam, crack MCQs, but your real knowledge is definitely going to be outdated.
Yes.
And in clinical practice, in conferences, and in the real world, where you have to make a statement, where you have a consensus meeting or consensus discussion on, okay, what is to be done for an unresectable carcinoma colorectum, you cannot quote what is written in Bloomgart and Shackelford. That is like preliminary knowledge. You need to know what is going on right now, in which part of the world, what have they done. That you will not know if you don't know how to read the journals, and you will not know how to read journals if you have never done any kind of research. You'll not be able to figure out the statistics and things like that. So it's a very good thing to actually pursue research, because it is going to enhance your skills as a clinician,
Yes.
more than anything else. So that's going to be the most important take-home message for everybody who wants to actually pursue research as a alongside their clinical career in surgery.
So this aspect even I realized when, like, in the recent times, whenever I attended any international conference, I saw that the lectures were solely based on the articles and the publications of the international faculty who have shared their experience. And sadly, there were very few Indian publications, to be honest. And
Yeah.
that I feel that if the surgeon has a experience or has that number of patients or they can
Yeah.
do research, they should do it, I feel.
They
That's
should,
a
but
very
then yeah. Sorry, like in this part, I would like to also add one more thing. I mean, there are definitely some good surgeons. There are some very prolific authors, even from our country, who are like very motivated for research. Like Dr. Nandi has the largest series of shunt surgeries. Like
yes,
his series is definitely largest in the world. So there are researchers like that for definitely in our country. But another very big hurdle is the standardization of research. Like
yes,
you have on one hand such ethical researchers like the ones I have
yes,
mentioned. On the other hand, you have certain researchers who publish completely fraudulent data, and it's like completely fabricated, and there is a lot of research malpractice which keeps happening. That's why, to the people in the West, and most of the reputed journals are from the West, whether it's Annals of Surgery or it's International Journal of Surgery or New England Journal of Medicine. You will see very less Indian papers actually making their way into
yes,
those journals. There is a bias for sure, like they have a bias towards the North American study groups. But one of the very important reasons of bias is also this, that there is lack of standardization of research practice in India. So, and they are very well aware of it. So because of certain research fraudsters, like the ethical and the honest researchers in India also suffer, and that kind of acts as a demotivating vicious cycle. But having said that, I think it's not necessary that you only should target the top journals. Like even
yeah,
if you even like if you do good research and you can make it to any decent journal, that's fine. Like doing some research is better than doing no
doing
research
nothing.
at all. Yeah.
True, true. Very rightly said. So we have talked about surgical gastroenterology, about research. Now coming over to something which you are currently doing, that is transplantation. Now, first I would like to start off with a very basic thing, like how if I tell you to compare the landscape of organ transplantation between India and North America, Canada, like about the opportunities, challenges, everything. What is your take on that?
So the landscape is kind of different because in India, we are like, especially if you're coming from north of India, it's more of living donor transplantation. That I'm talking about liver here, okay?
Yes.
So in liver, like you do more of living donor transplantation. While in the south, you have a mix of deceased donor and living donor. It's mainly because of the difference in the cultural practices. Whereas in North America, it's predominantly deceased donor. So most of the centers over there, including like some centers like Mayo Clinic, Arizona, they are doing so many deceased donor, and their wait list time is so short that they prefer to do just deceased donor and not living donor. Like by the time they work up a living donor, they'll actually get an organ through deceased donor. So the landscape is very different that way in North America versus India. So that is going to be reflected in your training as well. Like in most of the centers in North America, especially in the US, you will be coming out trained mostly in deceased donor transplantation. You will not be trained in living donor, barring a very few centers like Pittsburgh or Colorado. Um, there are like some centers like these which are doing living donor, or UCSF. But then, barring these centers, and in the US, like you will not be doing much of living donor. You'll not be getting much of living donor exposure. In Canada, in Toronto, like does a fairly good number of living donor transplant. That's why it's one of the very sought after programs out there. Like if they're doing 170 deceased donor livers a year, then they're doing like almost 80 to 90 living donors, which is a very good number for North America. So if you're trained from Toronto, you'll get an exposure of both. So, but otherwise, in general, in North America, the exposure to deceased donor is more. Besides that, it's also the practice pattern is different. Like in India, kidney transplant is done by the urologist, and liver transplants are mostly done by the GI surgeons or the general surgeons who are trained in transplant.
Yeah.
But in and pancreas transplant, I think only SGPGI has a unit which is doing just kind of, they've just started, but otherwise it's not very significant enough. And intestine also is kind of not very significantly done in our country. Besides that, like if I talk about North America, it is abdominal organ transplant is one umbrella. It's done by abdominal organ transplant surgeons. Like you, and most of them are basically they do a fellowship after the general surgery training.
Right.
So, and their fellowship is in abdominal organ transplant. So they're doing liver, kidney, and in some centers, pancreas, intestine, all of these. So that's the first difference in like the practice pattern of doing of performing the transplantation. So scopes are different in both the continents. In India, if you are trained in transplantation, then you will be mostly like if you're in surgical gastroenterology and you are interested in transplant, in future you will see yourself doing more of livers. And that too after pursuing some sort of a special training in liver transplantation. You can do it from abroad or you can do it from India also. But then later on, you'll be practicing liver transplantation. You'll not be going into kidney. That's like a zone of conflict with the urologist. But then if you are practicing in North America after pursuing a fellowship from there, you will be expected to do all of it. So whatever you have learned, then there also the training might, the practice preference might be diversified. Many of the transplant surgeons, after completing their fellowship, they decide that, okay, we are interested more in liver. So they join a place, like they join an abdominal organ transplant unit, but they focus more on liver. Then similarly, some of them focus more on kidney. Then some of them, they want to become just a procurement surgeon because there's so much of procurement happening. So they need procurement surgeons as well. So they want to become procurement surgeons. And some of them even go to HPB. So kidney and pancreas works as one umbrella and HPB separate, liver separate, like that. But then the good thing is that there people have the liberty to make that choice. And if you join a unit or if you're looking for a job after completing your fellowship, they will ask for your strength and your preferences. And if you say, okay, I am more interested in HPB or my training has been HPB, and they have an opening for that, they will motivate you more towards the HPB. It's not like, okay, you're joining our team, you have to do everything. It's not like that. So you get that stratification and you get that liberty to make that choice. That is something because of the fact that it is more standardized and it's more systematic out there, their entire protocol. But in India, the practice scene is very different in transplantation. Like it's not done in public health sector at all. It's negligible. It's mostly private. And in private, there is immense competition between all the surgeons. So everybody wants to do everything. You'll see even the transplant surgeons sometimes doing hernias. So Like people just don't say no to any case. So it's a very different scenario altogether. So at the end of the day, you need to make up your mind, like what you see yourself doing and what gives you more satisfaction. And besides that, you have to also weigh in the other factors like logistics, like your family. Like, do you want to move with everybody over there? Do you want to like again move back? All these things need to be weighed in to actually see where you identify yourself finally doing.
So I think in India, if we talk about India, it is more of divided. If like you can correct me if I'm wrong. Till my knowledge, it is luminal, HPV, and transplant. So there are three subdivisions after doing surgical gastroenterology. So I think,
Yeah,
as you rightly said, it is always going to be subjective choice because all
yeah.
have their particular pros and cons. So we cannot say that something is better than other.
Yeah, exactly. And in luminal and HPV, you're also competing with a surgical oncologist, needless to
Yes.
say. So besides general surgeons, so that's another like area of conflict. So there are like multiple areas of conflict happening in these branches, like in these subdivisions. Transplant is fairly, I would say, untouched by the other surgeons because you
Yes.
need a specialized training for transplantation.
Yes.
So thankfully, it's still like a zone where only the transplant surgeons can venture into. But
Yes.
then, having said that, like there are so many fellowships which are mushrooming, whether it's in North America or UK, Korea, Japan, or in India itself. So slowly and gradually, that competition is also on a rise.
Yes, definitely.
Yeah.
So, like we talked about Indian graduates or Indian like residents or what they want to do. Now, if you are an international graduate like you, so what hurdles do you think that you faced or the students might face? And what is the right time to pursue or come to a decision that, okay, I want to pursue something outside India? And what is the right time to pursue, because we can do fellowship, so what is the right time to do that, and what are the career options if as an international graduate you want to think about abroad?
Okay. So I'll answer your second question first. So the right time is again a very subjective thing. In my case, I felt the right time was after completing my training from India, like, after completing my entire training from India, including super specialization, because it helped me, get a wider perspective of what I really wanted. Many people would argue that by saying that, okay, you could have done this right after finishing your general surgery also. But if I look back in time, after finishing my general surgery, I was not a mature surgeon. Like my approach
Yes.
was very different. And that is actually reflected in your day-to-day work also as a surgeon, I would say. Because when you join a fellowship in a foreign country, you have to navigate through a lot of things. It's not that straightforward. It's not like, okay, you go there and they are going to welcome you with open arms and you'll be mollycoddled all the time. It's not like that. Like the workplace toxicity and things like that, it is existent worldwide. It's a global phenomena. It's not something only existing in India. But the more mature you get in surgical training, your receptivity to these kind of criticisms and these kind of so-called workplace toxicities or whatever becomes much higher. Like you develop a more mature approach to deal with these things.
Definitely.
So I think that in my case, I made the right choice by actually, waiting till the time I finish all my training from India, because I also got exposure to many things which I wouldn't, which I would have completely missed out if I would have gone right after my general surgery training to the US or to Canada to pursue something like this, an organ transplant fellowship. So my entire training in GI surgery, luminal, HPV, that would have been completely missed in my career. But right now, I am at a position where I know that after finishing my fellowship, if I want to come back to India, I have everything. I have all the license with me. I have
Yes.
all the certifications with me and the experience with me to actually practice GI, HPV, or transplant, whichever I want to.
Yes.
So that is like I feel the in my like in my opinion, the good time is after finishing your some sort of a subspecialization or fellowship training after doing your general surgery from India is a good time to apply. Then, secondly, the hurdles that you think, as an international graduate, we have to face are actually many, which not many people talk about. Like we know that, like when we are applying for these fellowships, we are kind of competing with the North American graduates. They are the ones who are actually in the fourth year of their surgical residency, because in the surgical residency is 5 years in
Yes.
the US and Canada. So in the fourth year, which is the pre-final year, they apply for these fellowships, whichever they want to. And they get the result, and they have 1 year to complete their residency. And after that, right after that, they join the fellowship. It's similar to what we do out here for our MCH and DNB exam. Right after our general surgery, we join. Just the method is different. There, it's by applying and through interviews, and in our case, it's through entrance exam. So we are competing with those people. Now, the things that we need to actually face is, number one, the North American graduates will always have higher number of publications, most of them, as compared to you. If and as more so, especially if they are from like really prolific institutes like Johns Hopkins or Harvard Medical School and things like that, or Toronto, like they will have a lot of publications and research experience, and that's something we are always going to be lagging behind. So like I remember when I was applying for my fellowship and I was getting interviewed in Toronto, like some of my competitors during the interview, they had almost 150 publications. Like if you think I have 44, they have 150, let me tell you. So because they start very early on in their career, and many of them, they even do PhD and masters and things like that. So that's something you cannot compare. Then secondly, the other thing that you need to face is the visa issues, because the program directors, even if they know that you are a way more qualified, you are a way better surgeon, or you are, I would say, way more accomplished than somebody who's from North America, a general surgery resident who seems to have a lesser accomplished CV as compared to you, because in terms of work experience, we are always going to be ahead of them, let me tell you, because the volume that we see, they don't usually. Yeah. So that's there. But even then, the program director will have a preference towards a North American graduate, just for a simple reason that they don't have to deal with the visa issues. Right. Because most of the provinces, most of the states in the US or in Canada, they usually have a lot of licensing issues. Like, you should be like accredited through the American College of Surgeons and things like that, in order to actually get a license to practice. And their entire fellowship program runs on the fellows. So if the fellows don't get a license, then they cannot operate. And if they cannot operate, the entire system crashes. So they need to be extremely careful about who they hire. And the third thing is basically they also fear, that, okay, a candidate might be good, a foreign candidate might be good, he might be respectful, he or she might be respectful, or he or she seems to be a really good candidate, but they always feel that, will this person be a right fit to our team or not? Because you have to navigate through a lot of cultural differences also. Right. All your life you have worked in India, you're used to a certain way, you're used to a certain way of communication with the patients or with the paramedical forces. That whole system is very different in North America. Then even, writing progress notes and things like that, everything is very different in North America. It's electronic. So even though most of the private hospitals these days in India are switching into a North American style of writing notes and even the work culture, but even having said that, it is a challenge. And those are the things which the program directors usually fear in their head. So that kind of, I would say, stops them or prevents them, or, kind of deters them from actually, hiring the international graduates over their own graduates. So these are the important hurdles that you need to face, and you need to be really open about them in your mind. Like, it's better not to go with unrealistic expectations. Right. Like, till a few years ago, it was said that transplantation is the least competitive fellowship in the US or in Canada. But now, with every passing year, even that competition is increasing quite a lot. Quite a few very, very good students are from the North American colleges are actually applying for these fellowships. Many women are applying for these fellowships, and they are highly accomplished. So it's not like, you're like competing with nobody. You're actually competing with some of the very accomplished surgeons, who are like accomplished not just in surgery but in many other things in a global aspect. So the competition is high, so you need to keep your options open, and you should not be going with the mind that, okay, I'm just going to target Harvard Medical School, University of Toronto, or Johns Hopkins, and I'm not going to target anything else. If you go with that approach, then you will be at loss. A wiser approach is to basically target everything and then enter into the system, somehow just gain access into the system, if you are that motivated to be trained in North America. Right. So that is like, to summarize, these are the main hurdles that you basically face. And yeah. Sorry, yeah, go ahead.
No, you go ahead, please.
No, that's all I had to say, basically.
So, like, what I can conclude is that even more than the USMLE, which is something like like something after which you can apply for this fellowship. It is just one step towards the big journey, because you cannot
Exactly.
say that I've cleared MLE, now I am ready to enter into
Yeah.
foreign fellowships. I think
Yeah.
it is more than that. So experience matters, and even
Yeah.
your qualification in not just your surgical training, but other aspects as well, which matters. So I
Yeah.
think you should be somewhat accomplished in your position in India, and then you should try for that. So I think that's something which
Exactly. Exactly. And I can give my own example. Like I had a very accomplished CV, like when I was in India in 2019 and 2020, like in 2020, I had applied for these fellowships back then as well, like the clinical fellowship. And Toronto, like where I actually matched right now in 2023, Toronto didn't even like consider my application. They didn't even like call me for interview. So I realized that, okay, no matter how good you are, they don't really know you.
yeah,
So they are flooded with like 200 plus applications from all over the world. They don't have the time to see everything. So they ultimately go by what they think is going to be good for their system,
right,
which is just through letters of recommendation, which is just through the fact that they have seen, you working with them. So these last 2 years, like in 2021 and 2022, I had the time to prove my worth to them. So that's when I joined them, and through my hard work and through the results that I achieved, I made a place for myself where the program director was satisfied, and even the other staff were satisfied that, okay, fine, this guy is really good, so we can prefer him over the other people, that other accomplished people who are interviewing. Because at the end of the day, it's not just your publications and your work experience, it's also the fact that whether you are going to be a good fit to the system or not, which is judged by your personality and by the way you talk and by your behavior. These are also very important, which you and I also know. Like if we have to hire somebody tomorrow, we need the person to be a right
true.
fit. Yeah.
It's more
Yeah.
than what's on the paper and what's
Yeah.
actually appearing to them.
Yeah.
It's more important. And even I think that also applies in India in
Yeah.
somewhere, some aspects. But yeah, that is a very valid thing.
Yeah.
So I think I have asked you a lot of questions, and I have like you have answered them, and I think whatever you have said and whatever experience you have shared, I think it will be a very good stepping stone for all the future GI surgeons or practicing GI surgeons to decide about future if they are in a dilemma, or also how to go about this journey. So
Yeah.
I'll definitely thank you for joining us. And although I have had the experience of listening to you before also, and that has been a key role, which has played a key role in my shaping up as a GI surgeon right now. So I'll thank you for that, and I'll thank you for joining us right now and giving us your insights into this field. So thank you for joining.
It was my pleasure to join your this very good platform that you have started, and I'm sure, like, I hope that I could actually make some difference to some of the surgeons who are motivated enough to actually pursue something like this. And I would be happy to take any questions from your audience. They can reach out to me if they want to, so through your portal, and I would be happy to answer their questions whenever they want to.
Sure. So thank you all for watching, who will be watching it. So as Dr. Samrat said, if you have any questions, please do reach out to me and share your questions. I'll be happy to send across to Dr. Samrat and share his responses with you. So I hope this helps you and guides you and motivates you to pursue the field of surgical gastroenterology and transplantation. So thank you all for watching, and thank you, Dr. Samrat, again for joining us.